Yeah, I'll give you, yep, I will, okay.
Okay. I tend to move around better than I sit down, so I'll stand up if that's okay with you guys. So, my name is Joe Wiley, and I am a social worker, and my current title is therapist at Peninsula Lighthouse. I lead an intensive outpatient group, and I have done that for about the past 6 years. In my career, I actually, some of my first work was with adolescents at Peninsula Village a long time ago, and I lived there, because you live there 3.5 days a week, for 8 years, and worked with adolescents. From there, I worked as a director of a supported living facility and organized supported living for young adults. So I started working at that point from 18 to 22-year-olds, that sort of population, which I know is a little above the teens, but I think there's such an overlap that it might be important to mention that sort of thing. And now I'm an intensive outpatient, which means I get to go home and don't have a pager, which has its benefits. So I understand that you guys are particularly interested in substance abuse among teenagers. And as I was talking to the professor earlier, you were all talking about at-risk youth and some of the maybe more negative ways that we have approached working with clients, or some of our misconceptions in the field for this population. And I think one of the biggest concerns or myths that I hear when I'm working with parents or teachers or other professionals about teenagers is when they overgeneralize and say, oh, they're just being a teenager. That's just what teenagers do. Well, teenagers don't just become addicted to substances, because that's what all teenagers do. That is not accurate. Whether or not they may experiment because of what they're hearing, what they're experiencing around their peers, because of whom they're dating or choose to be interested in, tends to start a lot in those teen years. But we're seeing more and more that some of the clients that have longer-term difficulties report some of their first substance abuse experiments occurred 10, 11, 12, 14. It is not just for teenagers. One of the reasons back in the 80s that they developed middle school was to remove the young adults who started experimenting with drugs from the younger children, so that they weren't peers that were easily accessible to them. So I was active at that point. I went to Volunteer Girl State, and I was governor of Girl State and got involved in legislation and got to talk a lot with the governor, and you know, when that movement started and all the excitement of why middle school was such a great concept. And I think it did help, and I think it still does help, but it's not going to solve substance abuse, particularly when we see it occurring more and more at the younger ages. Now, middle schoolers don't have to go to someone in high school to locate drugs and alcohol. And interestingly enough, some of the newer substances that have become a major concern, and even the reason for some new legislation, are over-the-counter or something you can locate in a convenience store. And one of the #1, I don't know if you want to call them new wave substances, you hear the teenagers call all kinds of things. One of them is called DXM, or DM, dextromethorphan. And that kind of gets stuck on your tongue, and I'll write it up here. And I did make sure to bring something to spell it correctly. Dextromethorphan. Has anybody heard of that by chance? I know Clay has. He's banned from sharing at the moment. I'm going to share some stories that Clay was there for. Anyone else by chance know what this is?
Yes.
What is it? Cough suppressant that is found in cough syrup. All cough syrups? No, but many. Robitussin, NyQuil, hold on one moment, I'll remember the other two. Delsa, Dimetapp, and Cortisone, which I've never heard of. But all of those, even Mucinex DM that you can get in the capsules, you can take to excess, and it will build up this chemical in your body. And it behaves like a hallucinogen. Most clients, I say that because that's who I work with, clients who have taken this, teenagers who've abused this particular medication have had hallucinations, and even just dissociative hallucinations. You know, they talk about out-of-body experiences, they sometimes don't remember things, they have body distortions, that they will see their hands be different or their body. Some kids will cut on themselves and not be aware, you know, of what's happening. It seems cool and neat and because it's moving, much like some of the behaviors that are associated with mushrooms or LSD. This is a little different in the way it works in the brain, but it also causes psychosis. And long-term use can present as schizophrenia sometimes, or can be misdiagnosed as schizophrenia if the teenager or the young adult isn't honest about the abuse. And it's easy to access, right? Walgreens, I could maybe with a good wind spit over there and hit it, right? I can go in there and I have access. Typically, most of the young adults and teenagers that I work with steal it. That's actually how they get it. They don't walk in and buy it, because you don't walk in and buy one and say 3 tablespoons, take it, and start having hallucinations. It doesn't work that way. If it did, we would, maybe all of us have had that because we've taken it before. But if you drink 2 or 3 bottles, there you go.
It gave me the shivers. Just I hate the taste of it.
Yeah, I can barely take it just like 1 or 2, but the thought of,
Oof.
but then again, sometimes people have that same reaction to alcohol, which is still popular among the teenagers initially, but they keep going. So, like any substance, the initial reward of the euphoria, of the sense of freedom. In this case, you get energized. Typically, hallucinations or psychosis aren't from the first time that you use it. You kind of get this high. You might get some, you know, sort of hallucinations, more colors, changing things, but the longer you do it, the more intense and disturbing they become. One of the common things that occurs with the abuse of this drug, and there's not statistical significance between boys and girls in a study that I've seen, but I can tell you from reports from the clients I've worked with, from peers that I speak with on a regular basis, boys tend to initially start having psychosis and hallucinations around religious context. You know, they feel haunted by demons. I certainly know Clay experienced, one of the young adults, now he was 19, that I worked with, had that sort of reaction, was feared that he was seeing demons. And he was so confused, even about memories from his childhood about this, that there was a lot of difficulty in properly diagnosing him, because he talked about having experiences with demons and memories as a child. So here comes the question. Is it drug related? Is there some other diagnosis at work here? And it wasn't until this young man had been off for a long period of time could he say, I don't know what I was talking about. That did not happen. Interestingly enough, another young man that I worked with recently learned about this DSM from that same client. He then started taking Robitussin and started having similar experiences, to the point that he started cutting, like I said, on his body. And a lot of times this, of course, brings the family in. And telling, you know, what are you going to tell your parents? Don't let them go in to Walgreens. but really, don't let them go into Walgreens. It becomes a different sort of watching and concern and fear for your child, because anyone could get this. You know, anyone could pay for it, and you know, it's not like breaking into Fort Knox if you want to steal it. Not that I'm encouraging anyone to steal anything. But that is really certainly one of the new drugs. Some of the side effects that, even though I would consider hallucinations side effects and psychosis, it does cause euphoria, which in a way is a side effect, but in someone who's interested in getting a high, becoming euphoric, that isn't considered a side effect at the time, right? That's what you're looking for. You also get things such as vomiting, double and blurred vision, dilated pupils, not in the same way you might see opiate dilated pupils that are little pinpoints, but they will be smaller a lot of times. A lot of sweating, a lot of muscle spasms that can mimic opiate withdrawal, so that can also be confusing for parents or people who don't understand different types of substances that can be abused can cause different types of withdrawal symptoms. Some overlap. And let's say I'm a parent or I'm a professional and I understand opiate withdrawals, but I know nothing about DXN. I might be listening to this client in a group and say, have you ever taken opiates? And if I'm not someone who is inclined to meet the client where they're at and try to build rapport, but I'm trying to say, here's what you're doing, and this is what you need to do, I might accuse them or begin asking questions. So I might be traveling down a path that is really off-key because it looks a little bit like opiate withdrawal. So it's important to be aware of what you're really seeing. So a lot of times that looks the same as an opiate withdrawal. Another popular, I hate to use that term, but it had become popular particularly before July of this year, was synthetic marijuana. Spice is probably the term most used. This item is usually in a pack, small package, that has, it doesn't say spice on it. It doesn't say, you know, this is supposed to look like marijuana. Actually, no. It says incense, typically. And the other thing it tends to say is not for human consumption, which is true. It's an herb that is similar to marijuana, but they have taken it and put in additive chemicals. So, you never really know what they're going to add. Most of these chemicals are similar to what's found in methamphetamine. And obviously, what's that going to mean? You're going to have excessive energy, you're going to be agitated, you're going to have euphoria initially, and then hallucinations are common with this as well. I don't know if any of you heard about the cannibal man that, right, he was 31, and you know, he was so distorted, though he wasn't a young man, you know, he wasn't a teenager, you know, he killed someone and had really no concept. You see the same sort of cutting, self-abuse, distorted body that you will see with DXN. But it's caused from a different substance and a different chemical makeup. The common names for this: K2, fake weed, Yucatan fire, skunk, moon rat, rakes, and which none of those sound fun to me, but you know, it seems like either they might want to try a different name, but nobody asked me, so I guess I'm just telling you. But this I find pretty revealing, that in 2011, now this is poison control data, so this is good evidence-based information, right? The poison control in 2011 received 6,900 calls about, now this isn't just adolescents, but people being poisoned by spice. That is 24 times more than 2010. And I'm not good with math, so you can do the math and back it up. But that's a huge shift from 2010 to 2011. And because of that, and because people were dying from heart attacks, actually, young people. I do not know the percentage of those calls that were teenagers, but young people were actually having heart attacks because the blood rushes to the heart when you use this stuff, having heart attacks, mild heart attacks from this.
Question about how accessible is it? I mean, where?
It's extremely accessible originally. You could get it in gas stations, what they call head shops. It was really quite easy to find. Lots of gas stations, remarkably. And then they, literally after this man was televised on the TV, this awareness, they pulled a lot of them. And some of the head shops or some of the places that didn't have their foot in sort of a corrupt line, pulled them pretty quickly. Now, drugs, the DEA, I knew I was getting it wrong, got involved after this and started doing lots of investigations and began pulling it themselves. But it didn't stop it from getting on the market, particularly in more rural gas stations was the #1 place. You didn't get it from a buddy. But again, initially over the counter. You just go in and you pick it up. It looks a little bit like potpourri. Easy to hide from mom and dad, right? Throw it somewhere, that just, they're not going to think about that necessarily. July 2012, the Synthetic Drug Abuse Prevention Act. So that's where, you get this personal situation all the way up to policies and procedures in the legislature. It's probably saved a lot of lives. I know in the small little numbers of clients, percentage-wise, that we've worked with who've experimented, or what we would call the addicted to, actually, spice, has shifted. I don't know the percentage.
I don't know if I missed this, but do they smoke it, eat it? Like
you smoke it?
Okay.
You
like
smoke
you would do marijuana.
Very similar to marijuana as the primary reason. There have been some cases of people ingesting it, just eating it, and trying to boil it up and inject it. It's very rare.
So it is currently now illegal?
Currently illegal.
Okay.
And actually, interestingly enough, in August of this year, so that's only been a few months ago, Omega Labs has found a way with oral fluid analysis to determine if you've been smoking spice. Same thing for the next thing I'm going to discuss, which is bath salts. These weren't detectable before. You could be using spice and they couldn't drug test you for it. Now they are able to do this in this lab, and the reliability was significant enough that it was endorsed by the American Drug Administration as viable. So I think you're going to see a lot of places pick this up. I mean, I work here in Knoxville in a more public health clinic. So by the time it gets to me and affordable on health care, it's going to be a few years, till it becomes affordable because it's still new. But some of the higher end or parents who have the funds or anyone who has the money can start testing for this already. So I think you're going to see a decrease, certainly, at least if nothing else, some adolescents are going to be caught because there's a way to test for it. And the same thing again goes for one of the other newer substances, which is bath salts. Have you all heard about the bath salts? This isn't, you don't go down to Bath and Body Works and buy Calgon. You're not going to have hallucinations in the tub. It's not, like that. It is what's called bath salts, or again, they are chemicals that have been contrived and labeled as bath salts for you to inject primarily. That most people snort or inject. And again, you get hallucinations, psychosis. People die, heart attacks, because it is so intense. And really, again, it has this, and I'm not going to pretend I know how to say this word. Okay, I'm just going to write it because I'm not a medical doctor. Try and pretend that I'm saying it right. Maybe someone knows how to pronounce medical terms much better than I do. Yes, big long words. There you go.
What is that? P-Y-R?
P-Y-R-O-V.
Oh, V-A.
A-L-E-R-O-N.
Okay.
Methylene dioxypyrovalerin.
Valerin, yeah.
It's a guess. You find this same stuff, and the what's common, you hear doctors talk about it this way. People who deal with it all the time. DMPV. DMPV. Except I just made up new letters for it. MDPV. Same thing that you find in methamphetamine. One of the many. It's located in methamphetamine. So, what do you get in the brain? Stimulation, alertness, euphoria, hypersensitive awareness, but eventually most people have hallucinations. And become aggressive. It's not the kind of drug that you have hypersensitivity and you have empathy and connection, which sometimes comes with spice. This becomes more aggressive, much like will happen with methamphetamine addiction. These are the primary three newer drugs that adolescents have experimented with and are going to treatment for. Literally, there are facilities that have, within the past 5 years, added a component specifically to the teenage population and young adult population, sending their staff, putting on websites and advertising their understanding of these drugs. Why? Because they're new. And dealing with anyone who's addicted to a substance and understanding the substance they're addicted to, what their symptoms are, and how it changes them is important. Still, for adolescents, marijuana is still primary. Like I think in the study that was done by National Institute of Drug Administration, the last one I saw, they did 3 high schools, 36% of the children, I shouldn't call them children, teenagers that they surveyed, I can't remember, I'm actually remembering the number, but I can see the visual, 36% reported marijuana use, and the next thing closest was synthetic, they call it synthetic pot spice, 16%, and then it went down from there with cocaine being the smallest. And some of that is probably because it's expensive to smoke crack or to snort cocaine. That's one of the more expensive drugs, and a lot of teenagers don't have money at that level. Is it impossible? No. Probably many of you are used to having kids or have heard of teenagers that smoke crack or use cocaine, but it's still less common. And alcohol slides right in there as well. That wasn't part of the study because they did just drugs and they considered alcohol differently, but alcohol tends to be still statistically, unless you've got some new statistics that I don't have yet that have come out this past couple of years, alcohol still and marijuana still tend to run head to head for the most commonly first tried substance. I didn't mention this before with the spice, but sometimes some people with the spice initially they get relaxed, much like pot, they have that initial relaxation and kind of calming, but it turns on you and creates paranoia and hallucinations, and not always will marijuana. It'll take sometimes a paranoid slant and turn, but it doesn't, you don't tend to have hallucinations from just marijuana. One of the common themes that I think goes with this with teenagers is the argument, rationalization, sometimes explained as resistance. Well, it's an herb, as is poison ivy. I don't say that to them because that's not rolling with resistance, but I think in my head, poison ivy, I don't want to smoke just poison ivy, it will kill me. You know, there are a lot of herbs. I'm not saying that the approach of going adolescent and saying that, but it's certainly at some level when you have rapport and you have connection, being able to talk openly about what that means, and do they believe that, or is that just a good argument? Could be a time to say, what are some other herbs? You know, create some dissonance in their head between what's great about it and what isn't so great about it. I initially, when I got in this business before I got my degree, and was really sort of flying by the seat of my pants to some extent. Initially, when I got in this field, I was just a program counselor. I think I mentioned that I was living at Peninsula Village, and there was intense training at the time on how to deal with the adolescents that I worked with, and you were never alone with them without somebody to train you. And I was very blessed, you know, that was a part of my career, that I was able to have clinical supervision 2 or 3 times a week, much like you hear is so important. Not always the case these days, but certainly important. And if you can't get that, if that's not part of your employment someday, I want to invite you to find a mentor on your own that you can talk to regularly and say, look, I've got this client, my supervisor did this, we did this, what do you think? Because the more people that you include in your circle of knowledge that are knowledgeable, I don't mean let me just grab dude off the street for his opinion, that are in the research, that are in the field, not just doing what they did because they've been doing it for 10 years, but are looking at best practices and evidence. I say, you know, it will serve you, if anything else, just for self-care. I was just blessed to have it as a part of my work world. And one of the approaches at that time, which I won't say how long ago that was, just let that slide because it's double digits, was more confrontational, sort of almost intimidative, initially kind of intimidate and then pull back. And we realized really quickly that that's not always the best approach. There's a real difference between compliance and change. And adolescents can be good at complying in front of you, but what are they going to do when you're not there? And so if all we're getting is behavior change in front of us, we're not serving the population well. The new techniques, I call them new, they're I guess not new anymore, but motivational interviewing, I think, is a really great technique to work with adolescents. I also taught school. Yes, I know I don't look this old, but not through social work, but I was a special ed teacher, and I didn't understand, you know, at that point anything really about addiction, and I certainly didn't understand social work. I was in a whole different ball game, and my focus was very different, and my students were profoundly disabled. But I was working hard to get them integrated into what they call regular ed classrooms at that time. And this is when I started going into schools, I started encountering students who were dealing with substance abuse. And why they decided to tell, you know, the student in their room who couldn't talk, I don't know. Maybe it was a safe place to dump their stuff, you know, I'm not really sure. But I encountered a lot of students who were really dealing with substance abuse. And commonly what they said is, well, I have been to therapy, I am talking about it, but they're not listening to me. You know? I just recently, this week, as a matter of fact, was talking to a young man who's struggling, and he had gone to residential treatment, and we were chatting, and he said, I said, well, did you get connected to any of your peers there or any of the counselors? He says, the counselors still haven't listened to me. And I recall when I was living with, you know, in that role of living with clients for a long time, one of the big differences is that they actually we enjoyed them and they enjoyed us. Not all the time, but that was the goal, to connect. And I think that if there's one thing you can do through your career, you know, that I wish somebody had said point blank to me at the beginning was, get a mentor, get into the research, and build rapport. That's the key. Understand where the kid is. Instead of trying to change them, try to understand where they are. And then try to help them figure out where they want to be. And I think I see that, I do that a lot more, and I think the outcomes are much better. And the research seems to support that, so I find that a win-win. I like it when I do something and the research said, you did good, Joe, yay for you. It doesn't actually say, you did good, Joe, but you understand what I'm saying. Preferably, you know, see the research, then try it, but sometimes we are just going with our instinct, we're doing the best we can. If we then find out through our mentor or through supervision or get in some book or some article and go, oh yeah, that matches, it's a good feeling. Because then what you have on your side is probability. And that's all we got with human beings is probability. I want to go with the probability that says this usually works, as opposed to this worked with one dude in Iowa. You know, I'm not going to say that I haven't done stuff that I'm sure has been unique to the moment. Just a little bit, you know, because we're going to do that. But my goal is to be very sound with the choices that I make. And if I don't feel I can make them, then I want to refer to someone who can. You guys, is this helpful what I've been talking about? I can just run my mouth for a long
I'm
time.
just curious about prescriptions, you know, the abuse of prescribed.
What's actually interesting about that is it isn't so much opiate abuse with the teens as much as it is trying all kinds of things. Well, my mom had this, and she had that, and she had this, and let's put it all together and see what we get. Which sounds like really, but yes, really. I think.
So like different kids getting together and mixing all their different.
Mom has this, and Dad has this, and a lot of the children, teens with opiate addiction. Now I'm talking about early teen. Let me be very clear here. Late middle school, early teen, they tend to be the one who start this. Whip and swap, whatever you want to call it.
Farming.
Yeah, that might be a good word.
That's how I've heard it referred.
What's it called?
Farming.
Farming. Okay.
I got this. I'll trade you these 2 blues for this. They have no idea what the blues are. They could be, you know, something for to make you poop. They don't know. They make up stuff.
That's horrible.
It's true though. They do.
Is.
And then they think they know what's caused. And a lot of times, you know, there's the placebo effect. So they're like, I'm so high. And they're like, they took 7 aspirin and a heartworm pill. They, you know what I mean. It's a joke.
Could have been a hard one.
But they won't have heartworm.
And they will. Kids will experiment with dog or pet meds. They will. You know, when you were, I'm going to give this away, but I know when I was like 5 and 6, you know, we'd put mustard and mayonnaise and all kinds of goop together and try to get somebody to eat it. It's a similar concept in middle school. Yeah, but you can't eat this. And it is more with boys than girls, that is true, but don't, you know, it's not gender specific. It just has a slant more towards boys than girls. And then when they tend to get early high school, that's when they start to be more accurate. Mom has this oxy, Dad has this, or there's injury from sports, or there's just injury because they're getting bigger and flopping around. And you know, when you start going through puberty, most people are more, there's that clumsy kind of thing, and you tend to bump into things more, or you get really good at something, and then when you get hurt, it's more serious. So now, you know, gosh, you look sick, have an Oxycontin. You know, now, I mean, I got all of my wisdom teeth pulled with aspirin. I didn't need Oxycontin, you know, for a toothache, but today it's prescription. You know, it's common practice to start with a middle-of-the-road opiate that will, I mean, if you take opiates, you will be addicted. Thank you for playing. I don't care if you have 50 million prescriptions. I don't care if you have true pain. You will be addicted. You cannot not be addicted at certain levels of opiate intake, no matter who you are or where you come from. If you're human. I don't know much about aliens and avatars, but the human race, all there is to it. So you have true pain, you're going to be prescribed something. You put that in a little person, a medium-sized person, and that doesn't have all their frontal lobe development. And now what? We know 21, 22, 23 is when the full brain, theoretically, next week it might be 27, I don't know, but that's the research. We're learning more and more about how those neural pathways are developed, when they're developed. And if I'm already going through puberty and I'm starting to be told that I have to take this or I'm not going to be able to manage my pain,
Right.
that's the message I'm getting before I have pain.
And the message they're getting from their parents, from
the
the doctor,
TV,
from
from
the
the doctor,
Yeah.
from the dentist,
Right.
you name it, that's the message. And so you can maybe see how easy it would be for a teenager who, they're emotionally driven, right? They don't necessarily think through the consequences. They're not really aware of what they could be long term. And so they just try it. And the next thing you know, they're physically addicted. And then right after that comes the emotional and mental, I gotta have it, I gotta. Yes?
Okay, so this is just coming to my mind, but I know teenagers and children get addicted off over-the-counter medication. But you know how the medicine expires? Do they still consume that medication? Does it still give them the same effect even after it's expired? Because I know I don't take medicine.
The half-life, how long it stays in the system before it's completely run through and out, decreases. After that deadline that they write on the bottle, it doesn't mean it's not effective. It means it's not effective to the same potency. Eventually, yeah, it's not going to have much at all. But it doesn't mean that once that, December the 5th, it's expired, now it's the same thing as eating a cracker. It's not quite that. It's just, you would have to take a lot more of that to get the same impact.
Okay.
If that answers
Yeah,
your question.
it does. That's what I
about
was
the
thinking.
half-life and when it breaks down in the system.
Mm-hmm.
And a good pharmacist can help you with that too. I mean, pharmacist has to say, no, it's past the deadline, but if you happen to know one who can teach you about the chemistry, they'll tell you, they can sort of compute a general guess as to when things are going.
Did you have a question?
Yeah, Clay.
Oh, sure. So when kids have reached the point of being in, say, in the village or something like that, when it comes down to it, what are the reasons that they say that they actually did start? Is it mainly curiosity, peer pressure, wanting to escape from certain symptoms like emotional distress or mix?
I think experimenting is peer pressure. That's what you hit. But when kids get to the point that they're addicted, it's usually some emotional or trauma-driven or no connection to, honestly, adults or anyone outside of that little circle. They didn't have guidance, they didn't have connection, or they were really became attracted to, usually through young romantic relationships to someone, and it's their first love experience, and this person's like, let's try this, and I'm not saying that's over a significant number, but it's so incredibly common, particularly for women. Did that answer your question?
I really like prevention
Yes.
a lot,
Yes.
and I'm wondering, is there anything out there now that seems to be sort of a best practice? I know we had DARE for a while.
Yes.
We have had life skills training, Botvin's program. That's what I'm most familiar with. Is there anything else that you find to be?
I have not encountered an organized, put together approach other than those two. Specifically, I know that one of the things we thought would be effective would be parents saying, I used to do that, and that has backfired on us, as opposed to the concept that if you make a mistake, bringing it forward and problem solving, how can I do that differently, or how can we work as a team in a family, and it doesn't even have to be a family. Sometimes groups at school or church, or hey, my family and your family know this, and let's all get together and we kind of make this pact. Not a rigid pact, but the kind of pact is if we make a mistake, we can call and we will work together to be supportive. Because really all that is doing, and I know certainly the clinician I work with who works with adolescents all the time sees this is very effective with her kids. And I haven't seen a lot of research that talks about this problem solving or collaborative support method. Those are just the words I would use for it. But I know through clinicians that I talk to regularly, it's similar to how adults function in terms of a support network that will say, hey man, you know, you screwed up and you lied to me, and what are we going to do about it? And supportive problem solving and support you through cravings and support you through depression. That model seems to be starting to work, and surprisingly not, with teenagers. And they are so, you know, when you're a teenager, I don't know if any of you remember, I don't because I'm old, but how important other teens are. I mean, it's your little social microcosm, right? Just like, so when you get that pocket of people saying, we're going to support this, this is okay, and if you mess up, it's still okay, we'll come back to you and we won't kick you out or label you, you have a better shot at making it. Particularly if in that small group you have what would be a mentor, or I don't like to use the word adult, but emotionally developed, healthy-ish person is a better way to, you know.
A role model, someone you can look to.
Absolutely, role model. And not somebody who stands up on stage and says, I did all these bad things, now I'm doing these great things, but somebody who's right there going, no, that doesn't lead with what's wrong with you and what's the best choice, but well, where are we going and what are we going to do about it?
I guess as a parent, when I look, I mean, fortunately my kids are grown up now, but gosh, when I hear the stuff you're talking about now, what the kids are facing with, you know, kind of mixing this stuff up when they get with their peers, that scares the heck out of me. You know, I mean, it's like, how, to what extent do parents even know, have an awareness of how this starts and age?
I don't know that I can accurately answer that. I do think that if I had to guess, and somebody said guess right or I'd cut your finger off, I would say the majority of parents don't understand that.
Yeah, just not even aware of what the kids are experiencing.
Because what I might do with my peers and what I might do with my mom or dad, you know, but having a parent who's highly active in what I do without being that parent that everybody's like, oh, they're super cool, you can do anything with them. Not that parent, not the one who's like, oh my God, here comes, you know, Joe's mom, she's gonna make fun of, you know, she's gonna, but that in middle of the road where they respect you because you're consistent, but they'll still talk to you because they know before you go screaming and yelling or ringing bells, you'll say, all right, what's your plan? What can we do about it? And how can I be there with you? I'm not going to rescue you. I'm not going to go in there and tell your parents, but I'm going to hang right here and go with you to tell your parents. Or, you know, who can we get you some support for? How can I help you with your family? I think still the parents being involved in a child's life is still the best remedy. I mean, truly involved from a listening and understanding perspective, not just from a dictatorship or control or I'm the rule maker and this is the bottom line, I'm in your business. I don't need that role. Any other questions that come up? Yes, sir.
How would you counsel parents about, say if their kid does ask, well, you probably did the same thing, you know, when you were younger, or also even from a therapist perspective in dealing with that?
I think leading with, you know, my history and choosing to do that. Have I had a history of something similar to you? Yes, I have, and that's why I don't do it now, because I changed. It didn't work for me. I made mistakes. As opposed to leading with, yeah, I did it too, I totally understand. That tends to, I think you hear the first few words and then teenagers just kind of go, oh, you know. And I don't, And I think a lot of that's that their brain, you know, they hear that front thing and that executive function isn't always there, so they're not prioritizing all the information. The smaller the information and the more clear, and then the quiet listening, I think, is highly effective. One of the things I tell my parents all the time that I work with is, don't talk so much.
Mm-hmm.
Say it, not less emotion, clear information, and then just listen. You know, if you speak, respond, and react to everything your teenager in particular, or 3-year-old, there's similarities there. They just bring up different topics. Say, not similarities between the 3-year-old and adolescent, but how they can push a button. You know, because 3-year-olds, it's the first time they've done it, so everybody's like, oh my God! You know, and the teenagers like, oh my God, you're old enough not to do it. So there's that fear factor of parents or grown-ups who love people that aren't grown up. To be able to hold that inside and process that with someone else and not your child, and just stick with the point you need to make with your child, say it once, ensure they understand it, and then hold steady with that, I think is one of the best, most effective ways that you see parents manage their kid. Doesn't mean their kids stop using drugs, but what it tends to mean is they start to trust the parent. And when they start to trust the parent or the role model, then they might move toward you instead of away from you. You know, because part of the, and I started with this, so I should end with saying the completely confusing thing, part of adolescence is to push the boundaries, because they're trying to figure out identity, right? You said it was this way. In order for me to be separate from you, maybe I need to do it this way. Or maybe I can do it just like you, or maybe I can do it sort of like you. You know, it's trying to figure that out, so they've got to push it a little. But that doesn't mean every adolescent, like I said when I started, pushing every boundary, especially drug addiction, where it's a regular thing and they have to have it to function, where they use it to excess on a regular basis and have withdrawal systems, is not part of adolescent development. Did I answer your question?
Any other questions? Very informative, thank you.
You're welcome.
Very good. I appreciate you coming.
I appreciate your invitation,
Yeah.
and I hope I didn't go too long.
No, it's great. Great stuff. Thank you.